Hello folks, I'm Frank Severely Normal, and so are you. Now let's have a frank talk. Today what I want to talk about is the simplistic design the simplistic and beautiful design of the powerful Alberta healthcare premium tax, or how it was intended when it was originally envisioned. Now up here I've got a mock-up of our society, this being the whole of the middle class, and these being the taxes that support their middle class lifestyle. We don't have to worry about that right now. I've drawn that for future videos. Right now we just have to worry about this one. This broken one here. You see it? It's broken in 3 pieces. That was, and I'm going to reassemble it here. So, here it is. There's the pedestal holding up our middle class table of democracy that we eat off of. Most of us. 90% of us are in here. 90% of us eat off of that table. Now, this is the Alberta Health Care Premium Tax. AX, tax. That's how it was brought in when it was legislated. It wasn't a levy, and it wasn't a Alberta Healthcare Premium Revenue Tool. It was a tax. Now I know revenue tool is just another way to say tax, but it's a way to avoid saying words that the public cringes at. But I want to say tax is a good word. Tax is what supports our society. So, the Alberta Healthcare Premium Tax was designed in such a way that over time it would grow and get stronger, become a major pedestal holding up our middle class table of democracy that most of us eat off of. And how it would grow is this way. Every person over 18 had to pay it, unless they were still going to school and living with mom and dad. Then they were covered under mom and dad's. Now there were exceptions. The exceptions were based on income. Now the income, when it was brought in, probably the poverty line, or the cutoff line for the Alberta Healthcare Premium Tax, was probably maybe at $12,000 back in 1969. I don't know the exact number, but I'm just showing you how it was designed to work. Now, if people moved here from another province, it got bigger and thicker and stronger. If people reached the age of majority, moved out from their parents' house and weren't going to school, they had to pay their own Alberta Healthcare Premium Tax. And that made it thicker. And it got thicker and stronger, as it was designed to, for the first 2 years anyway. Anyway, there were exemptions for it. For anybody who was under a certain level, they didn't have to pay it because they didn't have the means to pay it. And it was designed so that as life got more expensive, in other words, as incomes went up, the exemptions went up too. In other words, $13,000 is not the poverty line today. Today the poverty line is somewhere over $20,000. So anybody over $20,000 was exempted. But what about the working class families? Maybe they were only making $20,000 and had 5 kids to feed and couldn't afford to pay that either. There was an exemption for that. It's called the Alberta Adult Health Care Benefit. There were exemptions for poor people. But as life got more expensive, as politics and regular inflation made life more expensive, the exemption should have been raised up and probably should have been at this point at near the $50,000 cutoff that Mr. Prentice tried to bring in on his new taxes when he presented us with that budget. So this should have grown thicker and thicker, and this should have gone up higher and higher, and the people paying the premiums, as these people were exempted, these people, the haves, should have had increased premiums to keep the total value of the fund year after year at a stable percentage of the healthcare costs. And this wasn't done, and the reason that this wasn't done is because the system was gamed way back in the years of Mr. Lougheed and Mr. Getty, when they were in charge. It was gamed between the labor unions and the government, and I'll explain that in another video. But this healthcare premium tax was needed in 1969, in 1979, in 1989, in 1999, and all of a sudden in 2009, they decided they weren't gonna collect it anymore. And that slid us into the deficit that is on the wall over there from my original videos. This is Frank Severely Normal saying, I hope you received this message well, and I hope you understand that this premium tax was designed to grow and get stronger and stronger, and had it not been played with, it would have. And it would have been paying a fair chunk of our healthcare deficit right now. I'm Frank Severely Normal, and so are you. I'll see you in my next video. Thank you.